Predecessor Robert Gibbs had some interesting things to say about the health care rollout yesterday. He said that it's been botched, and he said that when it gets fixed, quote, I hope they fire some people that were in charge of making sure that this thing was supposed to work. How do you react to that? And since Republican Senator Pat Roberts has called for Secretary Sebelius to be fired, does she still have the full confidence of the president?
The Secretary does have the full confidence of the president. She, like everyone else in this effort, is focused on our number one priority, which is making the implementation of the Affordable Care Act work well. And people are working 24/7 to address the problems and isolate them and fix them when it comes to the website and enrollment issues.
Yeah, right. And I got a bridge to sell you not too far from here. Welcome back to the Steve Malzberg Show. That was Ed Henry speaking to Jay Carney. Questioning whether or not the president still has confidence in Kathleen Sebelius. Of course he does. Could she have done a worse job? She's perfect for this administration. Joining us right now to talk about all this is Dr. Paul Howard, Manhattan Institute Senior Fellow and Director of the Manhattan Institute Center for Medical Progress. Hey, Doctor, how are you?
Doing fine. Thanks for having me on.
It's my pleasure. Thanks for coming on. I mean, I don't even know where to start. This has been a disaster. Even the Washington Post said that traffic, we keep hearing that traffic is so overwhelming that's what caused these websites to malfunction. Traffic has gone down 88% at healthcare.gov since it launched, from 9 million down now to 30 down to well, there's all kinds of numbers. Anyway, 88%. So what is the real problem here, and why is all this happening?
It's not just the Washington Post, too. The New York Times had a fantastic story by Robert Pear, very well reported on Monday, just saying how the entire process that was set up for getting the companies to design the website was designed to favor, companies that had lobbying expertise in D.C. The structure of the website was what really appears to be killing them right now in terms of they didn't want people to see premiums before they saw the subsidies that might come to them in the form of offsetting the cost of the premiums. That made it very unwieldy in terms of you have to check with the IRS, the Department of Homeland Security, to verify citizenship. Medicaid eligibility for state Medicaid agencies, a whole host of agencies that had to be queried in real time to try and establish your eligibility for subsidies or Medicaid. That made the whole program come crashing down.
You talk about the real policy costs. I think America has to now familiarize itself with something, especially people who are first-time shoppers for health care, with the term deductible. Because there are horror stories out there from people who were excited and wanted to find out, and somehow they managed to get on, whether it was their state or the federal website, and the deductibles are through the roof in many cases.
Even for bronze plans. So bronze plans are the cheapest plans you can buy. So they're going to have the cheapest premiums, but they also come with potentially very high premiums, $4,000, $5,000, $6,000, $12,000 for a family, and that is because what Obamacare does, it sets a baseline for coverage that says it has to have 10 essential health benefits, including maternity services, hospital coverage, prescription drugs, rehabilitation, drug addiction services, mental health services. So even if you're a 25-year-old man or a 53-year-old woman, you have to buy maternity coverage that drives up the cost of coverage. Now, you can get the premium down, again, but because of all of these expensive riders that have to come with the coverage, you're going to have very high deductibles.
All right, so once they get on, if they're ever able to get on, they're going to find this, and they're just going to turn away. I mean, first-time healthy people are going to turn away that don't have insurance, and that the system is based on this kind of pyramid, if you will, where it's young healthy people who don't have insurance that they're counting on to buy insurance that are going to fund it for the rest of us, correct?
Right. I mean, that's why you have to make the insurance as affordable as possible. And for people who might see a doctor once or twice a year, maybe to get a checkup, and don't really use the services, you want to make sure that whole package is as value-oriented as possible. I don't have anything against high-deductible health plans. They can be very effective for people. But that initial premium's got to be structured, and people need to know what they're buying. And I think people really thought that premiums would be coming down. President Obama said they'd be coming down by $2,500 a year. Obviously, that has not happened.
Yeah, well, let me give you just a little example here. This is from a writer at the Daily Kos, okay? So we're talking about, a left-wing situation here. My wife and I just got our updates from Kaiser telling us what our 2014 rates will be. Her monthly has been $168, mine $150. We have a high deductible. We're generally healthy. We don't go to the doctor. I barely ever go. The insurance is in case of a major catastrophe. Well, now because of Obamacare, my wife's rate is going from 168 to 302, and his is going from 150 to 284. So he's canceling insurance for both of them, not paying any penalty, he says. What kind of reform is this? And these stories are all over the web from people who have managed either to get on or whose insurance companies are now saying that because of Obamacare, they're raising their rates and or deductibles.
Right. I mean, they're ending some policies and saying, look, we're just not offering this coverage anymore because it's effectively been made illegal by the Affordable Care Act. I think a lot of people currently who are in the individual insurance market are going to find their rates going up. So there are going to be a lot of losers and a lot of winners. If you're at the low-income end of the spectrum, you qualify for Medicaid or close to Medicaid coverage, you're going to be able to get low-cost insurance, probably with a high deductible. If you're more middle income, especially if you're a younger or healthier person, you're going to see your costs go up.
I got another one for you here, and that one is the business aspect of this. As you well know, here I have one of the latest, the CEO of a major American fast food corporation. He's Andy Pudsder. He's a CEO of CKE Restaurants, parent company of Carl's Jr. and Hardee's. He's saying that President Obama was wrong when he claimed that the costs of Obamacare are not hurting job creation. He said in the 6 months in 2013 before the administration delayed the employer mandate, he and others were already moving their full-time workers to part-time status, and this has been described to me by economists as the new normal. I mean, we have more and more part-time workers now, as we see in the monthly jobs report, than ever before. And Kathleen Sebelius sat there on one of the shows and denied that that's the case, but that is the case, and it's directly attributable to the implementation of Obamacare.
It's a very big economy, but if you focus on, I think that's what the article references, when people saw the implementation period coming up, that's when they begin to make the adjustment. They don't make the adjustment in 2010, 2011. They start to make it right before they know the law is going to come into effect. They start adjusting their workforces to take account of it. I think everybody on the left and the right agrees, actually, the employer mandate is a bad idea because it penalizes companies, especially companies hiring lower-wage workers, by requiring them to buy expensive health insurance for those workers.
All right, we're talking to Dr. Paul Howard, Manhattan Institute Senior Fellow here on the Steve Malzberg Show, also Director of the Manhattan Institute Center for Medical Progress. Do you think even right now, even those who have tried, even though what we're hearing about the disaster and signing up and the disaster with policies and changing doctors and insurance policies canceling, et cetera, do you think the American public has any idea what they're in store for if this is implemented as is and we get 1 or 2 years into it?
Well, in a lot of ways, Obamacare is an extension of the status quo insofar as it's more regulations, it's more subsidies to different groups, it's increasing the federal government's control of health care. The track record of the federal government when it regulates things is it tends to make them more expensive, not more affordable. At the end of the day, I think people who thought that this was going to be cheaper, better, more accessible are going to find themselves dealing with a more bureaucratic reality. I think that Americans are going to want to move to something different after they get to experience that. All
right. Well, listen, Doctor, it's a very frightening scenario. It really, really is, especially those of us who are concerned about our health care and are savvy about our health care and hear the horror stories coming from other countries that have this kind of health care, and we see where we're headed. I thank you very much for your time, sir.
Thank you.
All right, Dr. Paul Howard.